So remind me, you were always nearsighted.
Always, yes.
Always nearsighted. And the glasses that you have here are how old?
These ones are only 2 years, I think.
2 years. Okay. And they're -2.5 on the right, -5 on the left, with a little bit of astigmatism. And up until, let's say, last year, your vision was good in driving, reading, TV. Was relatively good.
Well, with glasses on.
With glasses on, of course.
Yeah.
And you noticed that something.
I knew my left eye was getting worse, so I went back to England to do it, and they said that the left eye hadn't changed, but it was because I had a cataract that my vision.
And where was that?
That was back in England.
What, I mean, how far back?
That was when before I had these glasses. So these are my new glasses, and I still can't see properly out of my left eye.
No, I understand, but when were you first given the diagnosis of a cataract?
Oh, about 2 years.
So this is 2 years ago.
At least, yeah.
Now, regardless of when somebody told you that you have or you don't have a cataract, you have noticed that the quality of vision has changed.
Yeah, because even with these new glasses, as soon as I got them, I thought, well, my eyes aren't. Vision
They're not the
improved.
same, etc.
Yeah.
Is there anything objectively in your everyday life that this bothers you with?
No, not really, except that I'm just aware of it. So I sit here doing this all the time. So.
Do you have problems going downstairs sometimes?
No.
Do you drive?
Yes.
Driving at night? Lights?
I don't really drive at night. So it's only daytime driving.
Right. So daytime, when you get a lot of sun towards your ways, does that create glare? Or?
Not any more than that.
Right. Computer work?
I only do emails.
Right. No problem with emails.
No.
Okay. Well, the vision of the left eye looks quite reduced when compared to the right. Your vision has dropped to about 40% on the left eye. Your right eye is, with the glasses you're wearing, close to 70%. And we can't get the right eye better than 80%. Mm-hmm. Even with twinkling a little bit the prescription of the glasses. The left eye we can get, at best, at 45%. So there's a big discrepancy between how the two eyes see.
Mm-hmm. I'm aware most of the time I'm just using my right eye.
Right. So what's important on this stage is to look up a little test that we need to do when we first see people who have the difference between the vision of the two eyes, is to evaluate if there's a difference in the way you perceive light here. So this is a very bright light.
Yeah.
Is it the same intensity here? You notice the difference?
Well, it seems brighter on the right.
So this is a 10. How much is this?
I don't know, 8 or 9, quite
okay,
close.
So they're very close. Yeah. Good. That's very, very important. It's too complicated to explain, but it's very important. So that's good. That's good news. And now we'll come in here. We'll have you bring your chin in this chin rest. I can take your glasses here. I'll leave them right here with your bag, if that's okay. Right over here. Okay.
Forehead against this bar.
Yeah, forehead against the bar. So we're going to take a careful look at everything here, and then we'll discuss about it. So you have a remarkable cataract in your right eye as well.
I have a cataract in my right eye?
Absolutely.
But they've never told me about a cataract in my right eye.
I'll let you look at the pictures and see for yourself.
Oh, so both eyes.
Right. I don't know if they dilated your pupil, meaning they gave you drops.
Yeah, they have. Yeah.
All right. Or it could be a recent development. But lens in the right eye is very fuzzy. It has radial parts of it. There's parts of the U.S., not all the U.S., but there's states in the U.S. that they would require, besides vision, if you can concentrate on me. I know this is very, very cumbersome. Try and look at me, right at me, not the light. There you go.
I can't actually see you.
It's tricky. It's tricky and it's almost like torture. Try and look straight towards where my voice is coming from. So we can kind of evaluate the lens according to how clear its reflection is. So we have a cataract in the right eye.
Oh, really?
Absolutely.
They haven't told me anything.
Absolutely. I don't believe anything that anybody tells me. Unfortunately, that's my big problem with my wife always. So I always believe what I see. So, of course, the left eye is by far more opaque, and the left eye needs to be fixed. In my opinion, you should not be driving until you fix your left eye.
Oh, really?
It's not only a matter of whether you can manage. The fact is that lens, under some type of lighting, can make everything look milky. So that deprives you the ability to be responsive to abrupt things. I'm sure you've noticed in Greece,
well, that's why,
driving is a little bit of a task.
Yeah. Well, that's why I seem to be using only my right eye when I drive, because I'm conscious.
So you probably just close your left eye without.
Well, I just don't use it.
Try and look at me for a second. I know it's very, very tough, but we want to make sure the back side is good. Open the other eye and try to look straight ahead for a second. All right, that's okay. We'll take some snapshots with a camera. So the eyes are healthy. You do have cataracts in both eyes.
Oh, no, I haven't been told about. So the right eye, it's not as big as the left eye then?
No, but once you fix the left eye, you will feel a greater difference between left and right than you do now. What I'll do is I'll show you pictures here. I don't know how fuzzy you still are, but I've taken pictures of the lenses here. And this is your right lens on the left, and this is your... Sure, absolutely. And this is your left eye on the right. And you can kind of see them side by side compared with the same light. Now we call cataract any deviation from having the lens being perfectly clear.
Yeah.
And you can see this little milky...
Oh, that's just starting, yeah.
Right.
That's the right eye then.
But it's in the center.
Yeah, which they said it was the same with my left eye, it's in the center.
Right, it's in the center and it has these radial changes here. Okay. These are artifacts from my light, but this is a cataract.
That's the beginning of a cataract. That's my right eye?
See, again, this is very subjective.
Yeah.
I think that this type of cataract is more progressed and more difficult in driving than some cataract that we see in older people that they can see 20/20. They see 100%, and it only bothers them at night.
Okay.
So don't be surprised. The only reason I'm telling you this is obviously once you fix your left eye, you'll be able to judge your right eye, but you will probably be extremely more strict with your right eye than you have been so far with your left eye. And what facilitates this laxiness on your left eye is the fact that you have a little bit of cataract on your right eye. So your reference point is not 100%. So once your reference point becomes 100%,
on my left eye, I'm going to notice that.
Then you're going to say, well, I don't know what you did, doctor. My left eye went great, but now my right eye is
having a problem. Can I have a look at the right eye?
Absolutely. We'll put it side by side.
I just want to see how obvious that is.
Well, there's no comparison. I mean, this is the right eye.
Oh, that's very obvious.
Yeah, of course.
So that's the left eye.
But it's kind of similar theme here. Center, anterior cloudiness, the radial changes, and this is very cloudy, especially when your pupil closes. You're only using this.
Yeah, I mean, that's what I'm aware of, that it's cloudy, yeah.
Right.
But it's starting on the right eye too.
Yes, definitely. And it's very unusual for young people like yourself to have cataract. Sometimes they're related to corticosteroid use, some medications we use through the nose or inhale for lung problems.
I don't use medication.
You don't use medication? Okay. Sometimes it just happens. It's kind of very common in our days for people to get cataracts younger than usual. Usual is 70s.
Yeah. See, I don't know how old my mother was when she started. She had definite cataracts.
She had her cataracts too. All right. So we will make all the measurements and
so does that mean that both eyes ought to be replaced then?
Well, you first fix your left eye and you see how you function in your everyday life. It could be a year, 2 years before you have your right eye done, but it could be a month. You could come back a month later and say, wait a minute, my left eye is seeing great, but now my right eye is completely unsatisfactory. And that's purely a subjective decision. You'll make that call once your left eye is up and functioning, which is 2-3 days after the procedure. But in my experience, you're going to be very strict with your right eye.
No, it's just that when we get the letter to because we need a letter to the insurance people, so you'll have to say that they're in both eyes then, really.
Of course. More on the left than the right, and we recommend procedure on the left eye first. That's it.
Yeah, okay.
And according to how you function,
that's amazing that I can actually see that.
Yes, it is amazing. And another added factor, I'm taping all this for you. You're going to receive the DVD with all these on picture and all that discussion. So another interesting thing that we like to see is, another interesting thing for you to experience is the fact that your myopia is going to be corrected out of the left eye.
Yeah, and then
there's going to be an added annoyance.
Well, that's what I was thinking. I mean, it'd be best really to get them both done so that I don't have to have glasses. Otherwise, I'm going to have to take the lens out of my left eye, and I'll still need my glasses for the right.
No, we'll probably use a contact lens for a while. You won't be able to use the glasses. We'll probably fit you with contact lens for a few
Well,
months.
just on the right eye, you mean? So.
And see how it goes, yeah. And see how it goes.
Yeah, I've tried contact lenses. My eyes are very dry, so they stick.
Yeah.
I mean, I was told the last time I tried a contact lens, they said
we'll
you have
see.
to do a daily disposable.
We'll see.
Because I can't keep them in.
We'll play it by ear when the time comes.
Or rather, I can put them in, but I can't get them out.
Mm-hmm. And you always had that same difference between your glasses?
Yeah, they've always... Well,
always.
It's obviously got worse, because it didn't used to be... It used to be, I think, -2 and then -3.5 and then -2.5, -4.
Oh,
so my left eye's got worse.
Right. So they were always about 2 diopters apart.
But there were always there was always a difference.
Okay. The reason being is the level of the cataract of the left eye does not allow us to measure the eye by laser, because the best measurement for calculating the lens that's required for you to have when you have the procedure, so you don't need any glasses for distance, is done with a laser that measures this distance.
Right through the middle.
So the laser has to go through the middle, and it does measure the right eye, but it's unable to measure the left eye.
Because of the cataract.
Exactly, because it's obstructing it here. So the most important thing we've done for you today is that we have a measurement for the right eye. That's absolutely accurate, and regardless of what happens in the future in your right eye, you have that measurement.
Right.
So we'll keep that, and we'll try and measure the left eye with different means in order to get the most accurate measurement, and we'll give you that letter and take care of it from there.
Yeah.
If you decide to have it done in Greece, you can come here for a day, for an hour.
No, I'd rather have it done here. I'm not going to go back to England.
It's up to you.
But I do need the letter for them to
Absolutely,
pay it.
absolutely.
Otherwise they won't pay for it.
We'll take care of everything for you today.
Yeah.
And we've worked with Signet before. They're very good, actually. They're very good insurance. And
because I'd rather, if I'm going to have a cataract in my right eye, I'd rather have them both done rather than do one.
Of course, we'll see. We'll see how it goes. We're mostly concerned with safety here. We want to make sure that everything's done safe and everything's done properly, and we'll take it step by step.
No, I don't really do night driving, which is probably why I haven't really noticed it. But but I do drive. I drive every day, so. And
until you have it done, you have to be very careful with steps. Very careful with steps. Even you don't realize it, but you have to kind of hold on to something when you go down the steps.
Well, I do that anyway because I have a problem with my knee. So.
That's helpful. All right.
Why a problem with steps? Because I can't. Because of the.
Well, what happens sometimes if light hits the left eye in a certain angle, it can change the perception of depth, and some people trip.
Okay. Right.
And although it sounds silly, we've seen, knock on wood, people in the exact same situation come here with a collar.
Because
and they don't realize it's related to the eyes, and we tell them, well, it's probably the imbalance. But fortunately, it's very rare. I'm just mentioning it because I'm probably one of the weakest people as far as taking risks possible. So we will finish all the measurements. We'll fill all the forms for you. Our nurse will familiarize you with the whole process. Once you get it settled with your insurance, for us, it's just a phone call. You come in a day for a couple hours, you're done.
Right. Okay, no, that'll be fine. Because that's basic. No, I'd rather get it done, I think.
We need you not to wash it or put makeup for 5 days, and then you're back to your normal everyday life. In the end, once the right eye in the future gets done, you'll just have a pair of normal reading glasses that everybody else uses.
I have to have reading glasses then.
You can avoid reading glasses if you use multifocal lenses. They correct distance in near, but the displeasure with multifocal lenses is you have to do both eyes at the same time, or at least a week apart. You can't wait for one to the other. And
because these are slightly multifocal,
right.
because I've noticed that at the moment what I'm doing is I'm actually taking my glasses off to read.
To read. Yeah, that's a good thing. With multifocal lenses, there is the beauty of you don't need anything added, but the problem with multifocal lenses is that your quality of vision when light's dim, both at distance and near, is not going to be the same.
No.
So you lose some contrastivity, which a lot of people tolerate, but 1 out of 5 in our hands does not tolerate it. And if you happen to be 1 out of 5 in that group, we have to take the lenses out and put new lenses. And we don't know that beforehand. Okay. Nor is a trial with multifocal glasses good enough to tell us whether... So we don't really recommend multifocal. We put them occasionally, but I would, especially if you use a step approach, 1 eye first, 2nd eye later.
No, I think we'll just go for this.
It's impossible to do.
No. So basically, if I had my left eye done, I would have to take the lens out of this one, so I could just use this glass.
Yeah.
to start with,
yes.
until I have them both.
Yes.
And if they were both done, they would both be the same?
Yes, they'll be good for distance, and you need some glasses for near. Or we could make a difference of one diopter, so leave the right eye perfect for distance, and the left eye one diopter for near, so that way you will only need reading glasses for very fine print. That's another option that's not bad.
Okay.
And you're kind of used to it in your life, because your eyes were always a little bit different.
Always different, yeah.
But that will not give you perfect vision at night, because then your right eye will be perfect at night, the left will be good, but it's not going to be good
so
at night.
So it would actually be better just to have ordinary reading glasses,
the risk in doing that is you can have somebody who wears glasses both at night and for reading fine print. So then you need two pairs of glasses again. Where if you make one of those things perfect, you only need one pair of glasses.
When I'm reading, yeah.
And,
okay.
and it's a catch-22. We always want to get the best thing for you. So it depends on what you do in your everyday life.
No, so we're just good with the reading.
You have time to think about it. We measure you for all types of lenses anyway.
Okay.
So we have that ready. You kind of think it in your mind, and we'll see how it goes.
Okay.